within a week, she was so good. It looked like she was a completely different person.
Wow. Incredible. Incredible story.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Goel here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Dr. Shiv, Goel, who is a board-certified physician and visionary founder of Prime Vitality, recognized for pioneering the integration of advanced health technology, functional medicine, and aesthetic innovation. Trained at Mount Sinai School of Medicine, Dr. Goel has been honored as one of San Antonio's best physicians and featured in America's Top Doc and Texas Top Physician magazine. His groundbreaking work includes launching Time Vitality AI, a platform that personalizes wellness by blending artificial intelligence with holistic healthcare. Beyond medicine, Dr. Goel's commitment to personal transformation is exemplified by his achievement as an NPC men's physique bodybuilding champion at age 45. So, Dr. Goel, I'm going to call you Dr. G. Welcome and glad to have you here.
Thank you, Daniel.
Yes.
Thankful to have me here.
Yeah, so let's dive right into it. How did you first get into aesthetics and wellness?
Well, wellness, I've always been in the wellness, and I've been a physician for almost over 20 years. But aesthetics as such, I wouldn't call it aesthetics. I will call it that a way of living the life, because aesthetics, most people, as they are aware of, is about outer appearance. And my personal experience with it is until unless we fix what's going on inside, we cannot truly do the justice of what we are reflecting outside.
Got it. Now, what was your motivation behind founding Prime Vitality?
My motivation behind Prime Vitality is, number one, is the fractured healthcare system in America, where everybody is just focusing on more kind of a prescription medicine approach, where we are writing more prescription than actually having the time to listen to what exactly is going on. I've worked in almost every sector, whether it's inpatient, outpatients, academic, or critical care. And after about 17 years of me working over there, I realized that it felt to me that I was just becoming a part of the system, like triaging and just symptomatically managing it instead of really making a difference. And that's when I decided to start Prime Vitality.
Got it. Now, also, I want to talk about Time Vitality AI that was mentioned in your introduction. So what is it and why did you create it?
So Time Vitality, it is, that first of all, with the introduction of AI, now it's like through the AI, we can not just accurately find out what's causing the inner issues, but we are able to blend and find out the root cause analysis of the issue which they are suffering from. And it is when I was going through AI has become more kind of I feel like that it's becoming a part of your normal life, So I wanted to blend our Eastern ancient wisdom of medicine, which we already have it with us, with the modern evidence-based medicine and make it accessible, like a root cause analysis to the people whenever they need it, when they need it, at their home, at their office, or when they're having a real issue. So they don't have to wait in line or for months or for weeks to see a doctor or finally end up in the urgent care or emergency department.
Got it. So is this a little bit more from a preventative type of case, or is it more like as soon as they're experiencing it, then it's going to be able to help them?
No, it is preventative. Preventative is something people will not usually seek help. So you have to see that it is not about me as a physician or as a healthcare provider. It's also about the people, what they are looking for. So they don't usually seek any kind of a help unless they have an issue going on. It is like if you're having a headache only, then only you will look for, okay, what can I do about this headache? So preventative health goes along with the acute care, because when the people comes with the symptomatic care or when they're having the symptoms, that means they already been having something is been cooking inside them for a long time. Okay, so that is the time when you can really educate them, so they not just get the acute help at that time, but able to prevent it to happening further in their life.
Okay, got it. Now, I want to talk a little bit more going back to your practice. What are some of the most common treatments that your clients, your patients come to you for, and why do you think that they're so popular?
I think the weight loss is number one treatment, which most of the people they come for. And the weight loss is like a starting point. And anti-aging is another one where everybody wants to look good, you know,
Yeah.
and feel good from inside. And that those are the most common. And I think they why they come for is it is the same point why everybody it's like an approach. I don't think they really see that oh, is my hormones optimized, or I'm feeling really drained off lately. They don't come for those, or they don't even come for the things that okay, I don't know why my skin is more dry, why I'm having acne. They come when they're really forced to come, because it's like an approach of we want to put our money which can just make us look good from outside. So, but it is then when we get the time to sit down with them and really make a difference in their life by asking the right questions so they can understand. Like, suppose somebody come for Botox, simple example, and they think that by taking the Botox, all the wrinkles of the face gonna go away. Okay, that's what we think usually, or we look young after that. But that's not really the case, because Botox is not for the wrinkles. Botox is basically decoupling the muscles of depressors from the elevators, so the elevators can take over and we feel that we are looking good. But it is not going to alter your skin or anything which is happening inside the skin. But until unless they will know you, we sit down with them, they want to know it. So for whatever reasons they come in, we are able to educate them and help them so that they just don't become like a puppet in the hands of every other aesthetic or medical spa, but they get the knowledge to see what they really need to do.
Got it. Now, you talked about anti-aging, and there's this kind of wave that we're seeing where regenerative medicine treatments are coming into play, functional medicine, wellness, all of those kind of things. Are there any really new or emerging treatments that you're particularly excited about that it's coming into play that's maybe already here or maybe is right on the horizon?
I think when it comes to the more and more people, they started to realize that bioregenerative medicine, which is basically our body's own potential to regenerate. It is not something from outside. So our body is more smarter than we think it is. So whether it is the use of stem cells, PRP, PRF, whether exosomes treatments or any kind of nowadays the myoglobin beta 2, there are so many other new treatments are coming up for arthritis. They are coming with the like a monoclonal antibodies. There's a new medication which is coming up. Eli just has passed their clinical trials type 2, in which it's a medication which is an antibody against the myostatin. So myostatin 1 and 2, so that it can not just people will lose the weight, they will able to gain the muscle mass at the same time.
Okay. Yeah, because I know that I've heard some talk, especially when it comes to the weight loss, the GLP-1s, that it's good for losing weight, but then there's also kind of that hidden, you lose a lot of muscle, which is not great for your overall health. So
I think it's also, so there are two things which go side by side here, is that no matter what kind of a weight loss medications or you take it, you cannot lose the weight until unless you have a negative calorie deficit. Okay, so every time you have a negative calorie deficit, you're gonna lose some muscles along with the fat, because our body doesn't differentiate between muscle and fat, and it takes less calorie to break down a protein into calories as compared to break down a fat into calories. Okay, so when we are losing the weight, like even when I was preparing for my bodybuilding, a lot of my athlete patients, when they are in the cutting phase, we increase the amount of protein they are consuming, so that the body, instead of using your muscle protein, they can use that extra protein if they need to, and finally they can attack on the fat cells.
Got it. And I do want to bring that up as far as you being that NPC men's physique bodybuilding champion. I mean, I think this is a huge differentiating factor of you from a lot of other people in the space. So what got you into that? It's like wanting to compete in the men's physique bodybuilding.
I think one of them was that I always wanted to, I'm a person who always wanted to stretch my limits to see what I'm actually capable of. And it is more that journey which has really made me realize a lot of things than actually winning the competition. A lot of people, I'm a kind of a person, I will not preach until unless I have done that myself. I have gone through that process myself. So until unless you go through the process yourself, you will understand what are the common things a common man usually go through or feel like. It's like, I see a lot of times there are so many cardiologists, they have probably 300 pounds, 250 pounds, and they are telling the people, oh, you should exercise 3 to 4 times a day as per the NYHA recommendations and everything. And that makes me feel like that's really not fair because you are asking somebody when you haven't done that. And plus, it also provided me an extra edge to understand how the muscles work, what is the pathophysiology of the muscle science, and what it takes to lose the weight, to maintain the weight, to stretch your limits. Because people often feel like that, okay, it is easy to lose the weight. They can lose the weight, but how do they maintain that weight loss? How do they maintain not just losing weight? We are not here just to lose weight and look skinny. We are here to experience the life, to live the life, to be happy, to be contented, to live, not just exist. Mm-hmm. And that was, I think, a mindset change which I had when I decided to go that direction.
Wow. Incredible. Especially to also win the champion. That's incredible also. Right. Dr. G, you were also voted as one of San Antonio's best physicians. Could you share a little bit about how your approach kind of led to you being voted as one of the best physicians? Like, what is your approach? How do you look at patient care and client care?
I think I did not started anything just to be the best physician. My approach has always been to do my best for the patients, to provide them the knowledge. And I think that's one differentiate me from the other providers is that I do not recommend something just because a patient wants it, because they don't know what they really need. Or number two, because it's in the fashion, because they are hearing, oh, this is what I need, it's gonna take me. I sit down with them and I go through what exactly happening. As each person has different reasons for gaining the weight. So their reasons for losing the weight not going to be the same as well. So it is, I think, it's just the reviews and the how the patients felt after being here in my clinic. That's what I think gained the attraction.
Got it. Yeah, I think that's also an important point that you bring up as far as sometimes you have to be very honest with the patient and sometimes tell them no. And even in that sense, you tell them no, but it actually builds up more trust.
Yes, because I don't think that my approach is never being a profit over the people. Mm-hmm. I always keep the people first and profit follows after. Mm-hmm. And those who do not believe in it, maybe they are not ready to have the right plan of care for them.
Mm-hmm. Got it. Now, also, I want you to talk a little bit about your team, Dr. G, like the strength of your team. Like you have a successful practice. Obviously, you need to lead people to see success. So tell me a little about your team, like how you're able to find them, how you're able to lead them to, I'll call it success.
I think the most important thing when choosing a team members, and you have to go through many, there's so many people in your team, they will come and then go. It's kind of a learning experience and a curve. But the people, those who really stay and finally able to deliver and the people praise them are the ones who identify with the philosophy of preventative, what we stands for, and they're able to go that extra step to make it happen. So like when a patient comes into the clinic, whether it's our nurse, whether it's our front desk, whether it's our MA or an esthetician, whosoever it is their responsibility that we don't divide the work. Okay, this is my work. I stop it here. After that, this is it's like a team. It's like you're working in a family that if you are in a house and you have 5 family members, they all in a family. So if somebody rings a phone, somebody's calling, so anybody can go and do the things,
Mm-hmm. Got it. Now, I want to switch tracks over a little bit to your clients, your patients. I'm sure you've had a lot of people come in through your door, and I'm sure there's a lot of misconceptions, a lot of myths,
Yes.
a lot of misbeliefs. So what are the most common ones that you typically hear from your clients and your patients?
I think the most common one is their belief that by doing one thing, they will reverse the whole aging process and they will look 10 or 20 years younger, such as by one of the things, as you mentioned, the GLP-1 medications, whether it's a semaglutide or tirzepatide. And a lot of time people think that if they are overweight, by taking that medication, they will lose the weight and they will feel awesome and they will have their life back and they will be achievement. No, it doesn't happen like that, And the same way is when it comes to the anti-aging or longevity, it is not the Botox, it's not the filler. It is none of the things which you can do it from outside, which can really make you look young or make you, because when I said feel, because that's the most important thing. If you can look beautiful from outside, but you're feeling cracked from inside, how are you going to feel it?
Yeah.
A smiling heart, a beautiful smiling person is more beautiful than a person who just look good and have a broken heart from inside.
So it's all about fixing what's on the inside first, then that will be reflected on the
outside. And then it's easier to fix the outside to match the inside.
Got it. Okay. Now, Dr. G, I want to get your thoughts on what role do you think that creativity, artistry plays in your approach? Because people think about medicine, they think about anything medical. There's the step-by-step process. There's a protocol in place. Follow this, like don't deviate. But where do you think that creativity, that artistry plays into what you do?
I think it's all about the creativity and artistry. And creativity and artistry is part of us. It's a part of all humans. There is nothing which happens without creativity. And that's what differentiates us from anyone. And I do not say that it differentiates us. I think eventually they all have to catch up with it. And only the ones who are creative in their approach will be able to understand what it takes to be in the shoe of a person who is coming to our clinic, because they don't know. And if you're not creative enough to understand what is going in their mind, what's going on in their emotions, how they are dealing with their everyday issues, how their hormones are contributing to it, is there anything which is going inside them which might be contributing to what they're suffering from? Because aging is a process which is not same in everybody. We call it a apoptosis, which is how each cell age. And that is different for every single person. Some people, they may age 10 years in 1 year, and some people age 1 year in 10 years. So that means this is an art of knowing how to, we cannot prevent aging. Aging is beautiful. It makes us mature. It gives us experiences of life, but how to age gracefully so you can look in the prime of your health to feel the vitality of life. And that's what the prime vitality is all about, to capture everything. Like an artist who is drawing a painting, if he doesn't know how to put different colors into perspective and paint it and give out something which even those colors has no idea that they're capable of creating that thing on the canvas. And I think that's what healthcare should be about. That's what the any sections, any business, any leadership, anything, it has to be. Without creativity, there's nothing.
I think also you touched on an important point, the personalization side of it. Yeah, having the creativity, have the artistry, but it's also not going to be the exact same protocol for every single person. Like you mentioned, people age at different paces.
Everybody is different. And that's why it's very important that I cannot recommend. People say that, can you recommend me write a prescription for the GLP-1? I said, I cannot, because I don't even know what are the real reasons you had the weight gain to begin with. I don't know what's going inside you. I don't know, because we have to follow up your labs. I need to see, maybe there's so many things which inside going wrong. And if I start you on something, it may deteriorate and you may have more side effects than having any effect.
Got it. Now, Dr. G, I'm sure that you've had some challenging cases over the years through your experience. Is there one story that really stands out in your mind about just a case that was really, really tough and how you were able to get a successful outcome in the end?
Well, there are so many cases I had it, and but I think one of the cases, if I remember, is that it has a patient who arrived with years of going through exhaustive investigations and numerous treatment, and it was all and nobody could figure out what's going wrong with her. She's been to a neurologist, she's been to a ophthalmologist, dentist, dermatologist, endocrinologist, everyone. And it's like everybody is writing a prescription for something which they are not sure, and none of them were talking to each other. And I don't think anybody was talking to the patient to really understand what's going on. Because when you said artistry, artistry is listening to the patient, because the patient will tell you the whole story. If you have the ear to catch those phrases and put everything in perspective. So this patient it all started after she had a dental surgery, and after the dental surgery, she had this appearance of some rashes on her face and then on the body, and they thought it's an allergic reaction. And after that, 2 weeks later, she stopped seeing. Okay, and then she went to an ophthalmologist. Okay, then she started having those bad headaches. So they refer to a neurologist. Okay, then somebody did some test for anti-nuclear antibodies, which came out to be high, and so they refer to a rheumatologist. So she was just going on from one to another, and her symptoms keep persisting. None of them has relief. And so her husband, who was a chiropractor, he somehow, I don't know how he probably was searching on the net, and he came to me. I just have to talk to the patient. It took me an hour. I just listened to the patient and asked the right questions. And I knew what exactly started, what led to what. Mm-hmm. And this patient, her mother had a chronic anxiety history. And so because she always has those anxieties, so she got that pattern from her mother. So she always have anxieties at the baseline, which causes probably her adrenal gland to be in a kind of a fatigue state. On top of that, she had her father and her brother passed away just before she had a dental surgery. Mm-hmm. So she had an acute stress on top of a chronic anxiety, which she has had for years, which result in her adrenal gland going to the acute on chronic crisis, which caused her immunity to go down. So when she had the dental procedure at that time, her immunity, because it's another physical stress on top of what she's been going on, so much of emotional stress, chronic stress, and unresolved stress, which she has, which caused her activation of her herpes zoster. Okay, and because of that, she started having, and before you have a herpes zoster, you're going to have some problem of a headache, you're going to have some itchiness here and there, but nobody paid attention to that, and which result in activations also in the eyes, which is herpes keratitis, which can happen sometimes when you have really bad, your immunity goes down very low. And as a result, she went to the ophthalmologist, who didn't think of the whole picture, because they just do all the testing from a ophthalmoscope, they did everything, MRI and everything. They couldn't find it, because you can't find a herpes zoster virus sitting up on an MRI. You cannot. Yeah. Okay, so as a result, now she did have probably some allergic reaction to antibiotic, because they started a bunch of antibiotic except the right antibiotics, but nobody was addressing and checked her adrenal gland. Nobody checked her serum cortisol level, because insurance doesn't pay for that, and most of the providers, they look for a diagnosis which they can put in a box so that they can bill for it. Okay, mm-hmm. Yeah. So, but we don't come in a box. Mm-hmm. Our body, our stories don't come in a box. We all are different. So by addressing all those issues, I found out that can lead to the migraines too. So we did her salivary hormone test, and 5 times a day, and I found out her adrenal gland was completely shut off. It couldn't mount a stress response. Like when we wake up in the morning, our serum cortisol levels should be high. That means your body is preparing you to be, let's go, it's a day. Okay, her hormones in the morning were low to begin with, and they didn't mount a response as the day progresses. That's why she would feel, when she wake up, so weak, fatigue, and she will have insomnia, GI upset. All those are the signs of having over stress. And so I have to deload her adrenal gland. So started on a course of steroids, and then I started on acyclovir first, because for her herpes. And she has severe vitamin D deficiency and iron deficiency because severe stress causes what we call a leaky gut syndrome.
Mm.
Okay, but how many people, you see that, how many people knows about it? How many people, even internal medicine or family medicine or endocrinologists, how many people really care about it? How many people really ask those questions to the people? They just want to write a prescription, bill the patient if they have insurance, or pay us, because it's a profit-based model.
Mm.
So they don't even check severe iron deficiency, severe vitamin D deficiency on top of what she was suffering. Within a week, she was so good, it looked like she was a completely different person.
Wow. Incredible story. It's great that there's an example of this, but I also think about on the flip side, how many people are going through this exact same thing and they just don't know.
There are so many, that's what I'm saying. And I had so many patients, they all have different stories, but there are millions of people out there, those who are suffering. And even though when they're going to the physicians, they're seeking the right help, but because the way the system is set up, they will never get the right help. And that is the reason I come up with the time vitality to prevent it.
No, that's fantastic. That's great. So Dr. G, where do you think the future of aesthetics and even wellness is going?
I think aesthetics and wellness, they are the part of the same coin. You cannot separate. What not going to happen in the future is every person who's not a medical professional, and I would say that who's just gone to a year or two of a study here and there, they cannot start any kind of a medical spa or aesthetic, I would say the business of aesthetics. That will stop in the future, okay? And only the people, those who would have the knowledge, because wellness and aesthetics are the part of the same coin. You cannot look good if you don't feel good from inside. And you cannot feel good from inside also at the same time when you don't look yourself in the mirror. It's like a chicken and egg thing, okay? So we have to mix both together at the same time to give you the right outcome.
Got it. And specifically for Prime Vitality, what is your vision for Prime Vitality?
My vision is that I can just able to do as much as I can to reach out to as many people as I can, to educate them, to give them the knowledge, and they will decide what will be the future of Prime Vitality.
That's awesome. That's a great answer. Okay, so Dr. G, what do you think is the most important piece of advice then you can give to someone who is thinking about getting some type of aesthetic procedure or aesthetic treatment done, but isn't sure which provider to choose?
I think you should choose a provider who, when anytime you go to a provider, you can know it by seeing and watching. Is the provider really focusing on or telling you something which really not making sense to you? Like suppose you have you want to look young. Okay, you said, oh, I want some lift. Okay. And if he's not checking out your labs to understand what's going inside your body, where your hormone stands, whether you're deficient in something or something else is happening, before optimizing it, all of it, if it recommends, okay, let's do a facelift, surgical facelift, let's do this, or I'll give you this first discount, that's not the right provider for you. And most of the time it happens when they go to the plastic surgeons or something, those who have no internal medicine or hormones or anything other knowledge. So that's the first thing, that's a step flag. Do your research. First, get the things done, right things done. And nowadays, if you're not sure of something, you can ask ChatGPT. It can tell you the things the things you should be watchful for. But you need to make certain efforts to type few words or ask them, is this the provider right for me?
Got it. Great advice. Now, Dr. G, I have one last question for you, but before I ask it, I want to point people to your websites at primevitalitywellness.com and also drshivgoel.com. Now, my last question is, Dr. G, what does beauty mean to you?
Beauty, a heart which is full of love, happiness, and which reflect that radiant light outside is beauty for me.
Well, there you have it. Dr. G sharing his expertise. So Dr. G, where can people contact you in your practice?
They can contact me. They can come through our website, which is www.preventativeWellness.com. Very soon, we are revamping the whole brand and coming up with a completely new take on the beauty and on the wellness by preventativeCare.com. By the time I'm currently offering a questionnaires of my prototype of timevitality.ai. People can use it. They can ask the questions and they can put any symptoms on it, and it will create a regimen based upon the diurnal variation and biotemporal markers. And that's how it's going to create it so that you will get a right advice to begin with. Okay. The other thing is they can also call us at 210-876-1635, or they can text us also at 210-837-3113. They can also reach us out to us through our Instagram, Facebook page, as well as through my podcast, which is Vitality Metrics with Dr. G.
Awesome. Well, Dr. G, it was a pleasure. Thank you for being on the show. Thank you for sharing your message.
Thank you, Daniel. Thank you for having me over here.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.